Okay, so now you've heard me talk about this app for a while, right? You want to demo it a little bit? Yeah, let's do that. So what I want to do now is I want to show you a little bit of what we're going to be giving you, the Biolimitless.life app. We are using a tremendous amount of technology with everything that we're doing. Let's see if that comes up. There we go. So what if there was a tool that you could have on your phone that your DNA genetic test could go on, your blood testing could go on, your brain cognitive skill test could go on. All this was here that really lays out the blueprint and picture of you. And you had an interactive app that you could work with that was AI driven that could give results to you that you've never had before. That's what this is. So let me show you a couple really cool pieces of this. So first thing, if you look at this, the bottom, it says cognitive age, okay? Cognitive age is the age of your brain. I think my wife would probably laugh because it says I'm 21 years old right here. Sometimes I'm like 15, right? But I'm not 21 years old if you didn't know that, okay? But my biological cognitive function is at that. So there's literally, you can go through here and we can run an assessment and we can literally test your brain function. And once you do that, you can see how your reasoning, your memory, your attention, your motor skills, your perception skills are. Why are those important? Because if your perception skills are off when you're driving, that could be a problem. When your perception skills are off when you're walking down the stairs, you have a higher risk of twisting your ankle, breaking a hip. If you have issues with memory, there's so many things that we can measure with this. We can measure your focused attention, your visual recognition, your preparedness. All of these are known neurological tests that we can do to measure cognitive age. And then we can go up here to the top right and press training. And we can literally do a training protocol, if it'll pull up for me, with neurofeedback. And the training for the brain neurofeedback is literally simple things that you can do on your phone, task-oriented skills that I was just speaking to a gentleman behind the screen a minute ago in the green room, and he says, hey, there's this app that I use when I go to sleep at night. I do this for 5 minutes and I sleep better. This is neurofeedback. So we literally can play games on our brain retraining phone app that you have to make your brain younger. Folks, your brain's a muscle. If you don't use it, you lose it, and Sudoku puzzles ain't gonna fix your problem. So this is really powerful technology, just that alone right there. So that's amazing. Let me show you a couple other things that we can do. Not only can we measure our cognitive function. Remember earlier I told you that there's some technology that we can use. I don't know if you know this, but during COVID, there was a lot of major advancements that have been done in the photo world, where they can measure your face and see if you have risk for infections, or how your vitamin and mineral balance are, your hydration, and etc. We now can measure your biological and chronological age through your face. Now, I've been speaking all day and I'm a little dehydrated, so I'm nervous to do this, but I'm going to show you a demo of how simple this is that we can do. And by the way, could you imagine if somebody went on here, did their face scan, which I'm going to take my glasses off because that makes you look older, and they're able to get an idea of what their face balance looks like. Let's see, perfect, move closer. Oh, what a good looking guy. 3, 2, 1. Boom, picture's taken, submit that. Now, 30 seconds later, it's going to analyze my face. It's going to analyze my lines, my wrinkles, my bags, my eyeballs, and it's going to tell me the good, the bad, the ugly. And this can change on a daily basis. But let's go check this out. Let's look at my stats. But what if you were able to measure your face health, which is an indication of your overall body health, and it was 20 years older than what your chronological age is? And then you were able to put X, Y, and Z into a lifestyle, and then you tested that 45 days later, and it went younger. I mean, how powerful is that? I mean, it really is some amazing technology. Whoops. So here's my stats. Let's see what it says. Okay, so my face. Okay, so I'm super dehydrated. My face says it's 40. I'm younger. I'm a little older than 40, so I'll take that. My eye bags are on point. My eye age. You can see how your pores look. It gives you an idea of where your body's at physiologically. I mean, it's pretty powerful technology. Isn't that great? Now check this out. Those are cool, but this is super cool. By the way, isn't this just, how sexy is the colors on this? It's pretty cool to look at. So now I go to my home screen and I go, all right, let me look at my DNA results. This is my own genetic test. So I can go through here and get it. This is my first page is the summary. Kind of gives you like an overall, what are the things that you should know about the most about you, what risk factors you have, etc. But let's say I want to know more about my diet. So I'm going to click on the dietary one. So my body says, okay, you have an okay response to carbohydrates. It's normal response. Well, how do we know that? You can click on that link. It tells you what genes we measured. It tells you about the carbohydrate response, how your body responds, specifically how you respond to things. And then you go down here, it shows you recommendations you can do. And then it shows you references with all the NIH.gov data to support the response of what you should do. So you can learn a tremendous amount about your health by how you process carbs, fats, proteins. You know, like my body needs a lot of protein. My body doesn't do very well with sugar. If I have high risk for snacking or metabolic issues, or look, like my body doesn't do well. Who's ever done a yo-yo diet before where they go for a while, they lose weight, and then they rebound back up higher again? Did you know that there's genes that predispose you to that? The yo-yo diet genes are right here. You know, so with all this information, we can put together a genetic profile and a plan for you. You can now go and look at all your health insights. So if you want to learn about you from an anti-aging, an eye, a gut health, a heart, immune, injury risk, mental health, muscle health, skin, sleep, stress, you can go through all those. You know, when Dr. Porter was talking about mental health, there are genes that we can measure that tell us if we have predisposition to certain issues. Look, if I have a predisposition for dopamine addiction and I know that I have a higher risk for addiction, then I can actually put something into my life I can get positively addicted to that's going to help me. Do you understand that? As opposed to being addicted to something that's going to cause problems. It says attention span. Mine says slightly lower. Okay, well, that makes sense. There's genes in here. See this one that says workaholic gene? This is also the other olic genes, the alcoholic, the any type of high dopamine response. So knowing these genes and how your body can respond to them is really a powerful tool. If you want to find out about your risk for injuries, this is something we do a lot with athletes. And by the way, you should know this as well. So for example, there are genes that cause a high risk for low back pain, bone and joint issues, Achilles problems. You know, there are people that actually have higher genetic predisposition for Achilles issues, knee issues, back issues, and etc. Well, if you know that you should be doing X, Y, and Z exercises to help yourself prevent that, don't you think that would be a powerful thing to do? So you can actually, once you get done with your testing, look at all this stuff you can do. You can get your health insights. You can look at the quality of your air, your genetic action plan. Your genetic action plan, you go through and you answer a series of questions. What goals are you trying to accomplish, and etc. And it takes all that information and gives you a plan that you can do, and it can track your lifestyle. And we can actually go here and go, okay, let's look at my DNA diet. So based off of what I'm trying to accomplish, I can change my calorie intake and etc. based off of my lifestyle. And then I can look at my micronutrients, my calories, my splits, how much water, what supplements I should have. I mean, we can track and monitor everything from this. And I think it's also pretty cool that, you know, I think it was Dr. Porter and CJ both mentioned the fact that, you know, we have a movement deficiency. There's so many problems we have because of lack of movement. But what if there were some simple movements that you could do to help improve your body? So like based off of my own genetic plan, if I go and I say, all right, I want to know what's a good workout plan for me. Okay, so I can click on this workout plan and it says, all right, if you did these 3 days on, 1 day off, 1 day on, that's the first week of exercise for you. Week 2 looks like this. Week 3 looks like that. And if I don't know what exercises to do, I can click my little button and then I can watch a video of how to do these exercises. So it literally is a mobile app to help you, give you the map, the keys, and the car to everything that you could possibly want to have. And we could put other health monitoring on here. We're going to API with wearable tech, sleep tech, all this stuff. Imagine if you could control all, not just getting your blood test in one spot, but actually what do you do about it, right? Like how many of you are so sick and tired of going to doctors or doing certain tests and then you get done and you don't know what to do? What if there's some things you could do? Well, this application helps you do that. We're going to go through a bunch of classes together on how to utilize this. It's kind of like an Apple Watch. The first time I got my Apple Watch, I was like, this thing's broken. I don't know how to use it. Now it's freaking amazing. So the same thing's going to be true for this app. So what do you think about this app and the information you're going to get? It's pretty cool, right?